All right, everybody, welcome back. You're listening to The Deep Dive, where we take a look at some of the latest and greatest in emergency medicine research.
That's right.
And today,
yes,
we are focusing on trauma.
Trauma.
Which we all know is one of the leading causes of death and morbidity.
Absolutely.
So anything we can do
Bravo.
to improve those outcomes in the field is a win for everybody.
You got it.
And today's topic is prehospital TXA. So
Yeah.
why don't we jump right in? I know
Let's do it.
you've done a lot of research on this topic, so
We have.
why don't you give us a little overview of TXA for those who maybe haven't heard about it or need a quick refresher?
So TXA stands for tranexamic acid, and it's an antifibrinolytic agent, which basically means it helps prevent the breakdown of blood clots.
Okay.
And so in trauma patients where bleeding is a major concern,
Yeah.
this can be a real game changer.
A real game changer. But we hear that a lot
Right.
in medicine, right? Game changer, revolutionary.
Yeah.
But does the research actually back it up?
Well, that's the great thing about this new study that we're diving into.
Okay.
It's not just one study. It's actually a harmonized analysis of two very large randomized controlled trials.
Oh.
So that means
Yeah.
they've taken the data from two different studies,
Right.
combined it all together, and analyzed it.
And that gives us
Yeah.
more robust data.
Absolutely. More data, less bias, more reliable results.
Okay, I like it.
Yeah. So what they found was that pre-hospital administration of TXA
Okay.
was independently associated with a lower risk of death at 28 days.
Whoa. Okay, hold on.
Pretty amazing.
So you're saying that if we give TXA
Yeah,
before the patient even gets to the hospital,
that's right.
they're more likely to survive.
They have a lower risk of death.
That's amazing. It's pretty incredible.
Wait, that's huge.
Yeah.
But wait,
There's more.
there's more.
There's more. Okay, tell me more.
So not only did they find that it reduced the risk of death,
Oh,
but they also found a dose-response relationship.
a dose what now?
Dose-response.
Break that down for me.
So basically what that means is that higher doses of TXA were associated with an even greater reduction in mortality.
Oh, wow. So the more we give,
Within reason.
the better they do.
Potentially, yeah.
Okay,
It seems that way.
that's incredible. But,
Yeah.
speaking from experience out in the field,
Yes.
we are always stretched thin. The
Absolutely.
resources are limited.
I hear you.
So lower mortality is great.
Yeah.
But what about things like blood transfusions?
That's a great question. And you're right, blood products are precious.
Extremely.
So what's really exciting is that this study also found that pre-hospital TXA was independently associated with lower 24-hour red blood cell transfusion requirements.
No, that's what I'm talking about.
Right.
So not only are we potentially saving lives,
Yeah.
we're also freeing up those resources for other patients.
Absolutely. It's a win-win.
That's amazing.
Really is.
But of course,
Yeah.
with any new intervention,
Of course.
we have to talk about safety.
Always paramount safety first.
So what did this study find in terms of adverse effects?
Well, reassuringly, they found no increased risk of thromboembolism, seizures, or stroke associated with TXA administration.
Okay, so
It's safe.
it appears to be safe.
It reduces mortality.
Yes.
It reduces the need for blood transfusions.
Uh,
What's the catch?
that's the beautiful thing about this. There doesn't seem to be a catch.
Really?
The evidence is really pointing toward this being a very valuable tool in our arsenal.
This is
It's
incredible.
very exciting.
So what's the takeaway here for our listeners who are out there
Out there in the field saving lives.
every day?
Yeah, the takeaway is that pre-hospital TXA is something that we should all be seriously considering incorporating into our trauma protocols.
Yeah.
This research is strong,
Strong.
and it has the potential to really make a difference, potentially save lives.
Potentially save lives.
Wow.
So
I mean, this has been an incredible deep dive.
it has.
I have to say,
Yeah.
we talked about the dose-response relationship,
Yeah.
that, higher doses
Yeah.
seem to have a
Greater effect.
greater effect.
Yeah.
Makes you wonder if there's even more
If that-
benefit to explore there.
Yeah. More research is definitely needed to find that sweet spot, that optimal dose.
Yeah, find that
Good.
optimal dose. But it definitely seems like something that we need to be paying attention to and potentially changing our practices.
Absolutely.
So much great information today.
Yeah.
As always, I want to encourage everyone to
Yes.
check out the research for yourself.
Please do.
Don't just take our word for it.
Read it.
Read it.
Critically appraise it.
Critically appraise it, and see how it can apply to your practice.
Exactly.
Stay safe out there, and we'll see you in the next deep dive.
See you later.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.